If everything is already hanging, then you do plastic surgery. And laser won't be effective.
Okay, guys, we're live and let's start. Welcome. Thanks for coming. Welcome to the Microinfusions and lasers and the daily routine taught by Pavel, Maskaljun, and Dr. Arion. My name is Elena, Head of Science of Liv. Few words on Liv Longevity Labs. As I said, we are on the mission to add 1 more million of healthy years to Europe's working age population, people who are above 30 or older. So we are a community. We have around 1,400 people. We also developed an app that helps to track and optimize your biological age. We have 450 people in beta testers, and we organized more than 45 events. And what is longevity? It's a lot of young people today in the audience. Love to see it, but longevity, guys, it's something that makes your quality of life later in life, when you are above 40, 50, 60, and so on, better. So that green line and the area between green and yellow, it all depends on you and on the knowledge and on your habits and on your commitments. This area will tell you if you will be able to play football with your grandchildren or go to the Alps when you are above 60, or you're just able to put your pants on and make a sandwich. And yeah, fun fact, in Germany, people tend to bring car to the car mechanics more often than their body to the doctor. Of course, you can bring your body to the body expert, go to Switzerland, pay 20 grand and get a super cool scans of your house, but not everyone can do it. And that's why at Liv, we are developing an app, and actually the product that will give you the feeling that you are a body user, like you're at the car you drive, you have this dashboard, you can see like what is the health of your car. So the same, you will see what is the health of your body. How do we do it? We use epigenetic test, which tells you your biological age, meaning all of your life experiences, how they integrate in your long-term health. Then it also gives you speed of aging, and this is the rate with which you age at the moment, meaning how your daily routine integrates in your long-term longevity, and fit age, which includes VO2 max, grip strength, lung capacity, and so on. And on top of that, you also have additional almost 100 biomarkers, which covers different organs, different systems, metabolic health, inflammation, and so on. Basically, it's like longevity Swiss clinic scan, but just with one test, which is basically a blood drop, and it's epigenetic, very complex algorithmic test, which again gives you that complexity and level of the insights. As I said, how it works. By the way, this is the test. We didn't develop it. If you know, Brian Johnson uses exactly this test. It's an American company, and they have a license for one of the best scientifically algorithm in the world, which is called Dunedin pace of aging. So we will analyze your data at Liv, and we will provide you personalized roadmap of tests and treatments and follow-ups based on your biomarkers values. And yes, if you're curious to join beta, you don't have to buy the test, but if you want to use the free app, we also integrate wearable data and lots of good goodies. You can always join us or find us online with Health. And with this, I would love to present our sponsors one more time. John, Brain Effect, thank you so much. Brain Effect, super cool supplements. I take them. I took yesterday melatonin spray, helping to fall asleep. Super cool.
Oh yeah, we invented the melatonin spray for Germany. We were the first ones to develop that, actually.
Super cool. Could dose the 3 milligrams so simply with it. 6 things. Yeah, and so Brain Effect develops science-based supplements for focus, resilience, stress resilience, and wellness. And they have wonderful also products for the gut health. By the way, I did PhD in the gut health, and so one love. And today we are featuring 2 incredible speakers. First, Pavel Maskaljun, he's the founder of Youth. He develops microinfusion technique and product, and it's something very specific, which sets apart microneedling that you can do only in controlled situation in the salon, and you don't do at home microneedling because it's kind of dangerous and not safe. But microinfusions is something that you can do at home. It's safe, it's great, incredible results. Pavel will show it, and he is expert in the beauty. He worked for many years in the beauty industry, and now with all of that experience, he transitioned into the science-based skincare. So we'll have talk about youth and microinfusions, and afterwards, Dr. Arion, he is a dermatologist. He also owns a private transdermal praxis in Prince Arbor. Yes, he's focusing on personalized skincare, laser treatments. He also has a surgeon experience. Super knowledgeable guy. Always talk to him, learn something new. Incredible presentations. I am jealous that you are here because I sneak peeked the slides before. So with further ado, I would love to invite Pavel, first speaker. Pavel, you have 20 minutes, and I have somewhere in my watch.
Oh, it's right there. It's right on the other side of the laptop.
Oh yeah. Sorry guys, not for you. So we have
We're trying to get better with our time. Yeah.
we have 20 minutes talk and then questions. Okay. Yeah, come on.
Yes.
Just arrow down.
Arrow
Down, and then you have this one is like there is no red. You are done with the talk, and then we have 2 minutes.
Perfect. All right, guys. Let's start. I want to start actually with a short question. Maybe it's very obvious, but still, what do you think? What's the largest organ of our human body? The skin. Something else? Other options? Which one?
Fascia, the connective tissue.
Okay. Yeah. Anything else? Well, I always also thought that it's actually a skin, but from our last workshop in live longevity, I learned that actually it can be also a skeleton and muscle, and it all depends how we interpret the word large. If we're thinking in terms of length, then that would be skin, and in terms of weight, that would be skeleton muscle. Now, what do you think if I would tell you that majority of skincare products don't actually work, or they don't work in the way we think they're supposed to work, or the way marketing claims are telling us they're supposed to work? And in fact, in this study back in 2007, the scholars found that most ingredients, they improve the appearance, but not the aging.
Pavel, can you put the hands on that camera, because it got used to me. We have some super fancy tech.
So my name is Pavel. I spent over a decade working in the beauty industries in various roles, but also working for corporations, startups, and beauty tech. I launched products, studied ingredients, negotiated distribution deals, and at some point, I had to ask myself, if the beauty industry is worth billions of euros, why still so many people feel that the skin is not improving? And I think we've all been in that situation. You know, go to a perfumery store, to an online store, and we see shelves full of cosmetic products, and there are peptide creams, there are anti-aging solutions, there are all those cosmetic products which offer us some kind of promises, but do they actually deliver? And if we think about the cosmetic product, basically they deliver only two functions, two main benefits. That's hydration and protection. And don't get me wrong, hydration and protection is very important. If we think about hydration, it's something which gives us skin glow. When we apply hydration cream, what it does, it basically pushes the dead cells away and uncovers or covers the imperfections like pimples, wrinkles, some pigmentation. But we also know what happens with the hydration or water. It tends to evaporate. So that's actually a glow. So we do have this instant effect, which seems to be working, but it's only temporary. Now, what about regeneration? And regeneration is totally something different. It has to do with the skin aging. And to understand the skin aging, we need to look into how our skin actually works. And our skin consists of different layers. Yeah, we have the epidermis, which is the upper layer. And the purpose of the epidermis is to protect, right? To not let things in. Then we have dermis, where actually all the magic is happening, where the aging processes are happening. This is also a place where collagen and elastin lives and exists. We also know from science that collagen tends to decline through the age. And generally it starts in the mid of 20s, end of 20s, and it starts to decline every year by 1%. And with the decline of the collagen and elastin, what is also happening that our skin starts to thin, right? It starts to thin also for a reason that the skin turnover starts to slow down. Skin starts to thin and the collagen declines, disrupts, and the skin is not anymore so smooth. First wrinkles appear and we start to notice first signs of aging. So the question is actually at the end, why skincare products cannot deliver regeneration effect or anti-aging effect? And majority of customers or consumers don't know about so-called Dalton rule. And Dalton rule basically means or says that ingredient which is molecular weight is above 500 Daltons is not able to penetrate the upper layer of the skin, so the epidermis. And there are ingredients, in fact, which do penetrate. This is only 1%, which I will speak a little bit later. But maybe the most important question is at the end, what actually works? Yeah. And for the product to work, we need to create this biological response, right? So we need to create a certain trigger for the ingredient to perform. And we have actually a method which has been studied for many years. There's a lot of clinical studies around it, and it's microneedling. So microneedling has been there for years, for decades. It's effective. It's proven to be effective. It's definitely working. And the principle of microneedling is to create a microchannel in the skin through the microneedles and deliver the active ingredients beneath the skin surface, beneath the epidermis. On top of that, by creating micro-injury, we kind of initiate the process of recovery of the body. We kind of say a body recover. And by recovering, we also stimulate the collagen and elastin production. Now, what are the alternatives? Are there alternatives to microneedling? And yes, there are. And Zach will be speaking about laser treatment, but there are also alternatives in terms of at-home usage, right? And probably the most well-known, it's Dermapen or needle pen or Dermaroller. Now, Dermapen is actually quite a cool thing. A lot of my friends are using today, probably you have also experienced using it. But personally, I find that it's a tool that has to be used in a professional setting. Why? Well, first of all, if you don't know how to use it, you can create more damage than benefit. And I very often see that customers are using it incorrectly. If you go to TikTok and you put in Dermapen, you see a lot of people are just dragging it around the skin. That's definitely not the right way to do it, because by dragging you create this micro tear and you can have a high risk introducing infection. And on top of that, Dermapen is regulated device, so meaning that you can regulate the depth of the needle, and it can go from 0.2 to 1.5 millimeter. And our skin is not equal. Some layers of the skin are thinner, some are thicker. And if you are touching or we touch the fat level by doing the treatment at home, that's definitely not good and definitely not something recommended. So I tend to think that Dermapen still is very much for professional usage. Then we have a needle roller. By the way, Derma roller was invented in Germany by Horst Liebel, and it was commercialized also by a German company which called Dermaroller GmbH, and they still exist. They're still on the market. But the problem with the Dermaroller is the way how it penetrates the skin. So it enters at 45 degrees and it exits also by dragging for the 45 degrees. And kind of when you perform the treatment, you drag, you have this uncontrolled movement. Again, you're creating too much unnecessary damage. And the second disadvantage is that you have to make sure every time you use Dermaroller that it's super clean, right? You don't want to introduce any infection. You have to also store it in a clean, hygienic environment, and therefore it can be challenging. Let's put it this way. Now we have something for professional usage, microneedling. Here, maybe the drawback is that it can be expensive, right? So start from 250, 300, depending on the practice, depending on which kind of ingredients the doctor is using together with the microneedling, and generally that's what's happening. And also you have to do it consistently. So if you do it once, you won't really, you will see the effect, but if you want to really see the big difference, you have to be consistent and do it at least a couple of times a year, because also the cycle of a collagen production is about 6 to 4 months, right? And then we have something for at-home usage, but it's not really ideal. So I was always passionate about beauty and technology, and maybe 5 years ago, I was more about aesthetic appearance and thinking of how can you look younger tomorrow, and we all been there. But today I changed my mindset, and I'm more thinking about the longevity and how can I sustain my skin long term, or how can I work on a preventative care rather than this instant aesthetic glow, which is very temporary, but not sustainable. And that's how Youth was born. Youth is a microinfusion treatment, and it's based on the principle of microneedling. So it creates microchannels in the skin. It uses the stamping methodology, so it's again penetrating under 90 degrees, and it's kind of a two-in-one solution. So you create a channel to deliver active ingredients beneath the skin surface to bypass the epidermis level. And we have very good ingredients within the formula. We have 3 peptide complexes, which are also working on different levels, improving the skin texture, stimulating the collagen, and also delivering the hydration. And aside from that, we're using clinically studied ingredients like niacinamide, chlorinic acid, and Centella asiatica. So microinfusion also, the benefit of microinfusion at home is that you can do it anytime you want. So it's very much flexible, and it's definitely much more affordable than professional treatment. Now, it's not a magic solution. So you will also get a glow, instant glow, which is short-term effect, but it's more positioned and developed with the idea of prevention, right? So here, the idea is to work on the skin health in the long term by stimulating, supporting the collagen through microtrauma and by delivering the active ingredients. Very often, I also receive a question whether microinfusion is substitute to microneedling, and I would say not really. I find that these two treatments are very complementary. So microinfusion can maintain the results which you achieve in the professional setting, be it a laser or microneedling or some kind of other invasive treatment. Or maybe if you haven't discovered yet invasive treatments. Maybe that's a good starting point where you can start with microinfusion, and later when you think, okay, I need something more invasive, then you can discover more professional services in the clinic or the praxis. It also very much depends what you want to achieve. So if you have deep wrinkles, deep pigmentation, it means that you have to also work on a much deeper layer. You have to go deeper, and therefore you need to also use a deeper needle. If you want to improve the texture, smoothen the fine lines, work on the pores, then microinfusion is perfect for that. And for preventive reasons, that's a great solution. Now, are there other ways how can we support and support collagen and elastin production? Yes, there are, and these are actually cosmetic treatments. So now you would challenge me, like, how come 99% doesn't work? Yes, it's true. Still, there's 1% which actually works. And for example, most of the time these are acids, right? So retinoids. Retinoids are proven to be a gold standard in cosmetics. They accelerate the cell turnover, and they help to boost collagen. Then we have also vitamin C. Vitamin C is a great product. We know that ascorbic acid is the best form of vitamin C. And also, if you're using vitamin C serum, make sure that it incorporates ferulic acid, because with vitamin C, the challenge very often is the stability. If the formula is not stable, it's basically non-effective. And we know that with ferulic acid, it is very stable. And maybe the most important is actually the protection, the SPF. So before even working and sustaining the collagen, we need to protect the collagen that we already have, right? So we had briefly this discussion already. UV, 80% of visible skin aging is responsible by the UV. UV damages DNA, but it also damages the collagen and elastin that we have in the skin. And red light therapy, again, we have also enough evidence to prove that red light therapy with a certain waves actually helps to sustain and to stimulate collagen production. Okay, just to maybe sum up, I want to leave you with one last thought. Maybe next time, if you're gonna shop for another cosmetic jar which promises you some anti-aging benefits or talks about collagen or PDRN, which is also very trendy right now, think if this molecule actually can penetrate your skin. And also think what you want to achieve. Do you want that instant glow, or you want really to work on something long-term? And today, again, we have plenty of different solutions where you can start doing something at home to professional settings and doing more invasive treatments. And I want to finish this talk with one of my favorite quotes by a chemist, Marie Curie, who said, "Nothing in life is to be learned, it's only to be understood." And now it's time to understand more so that we can fear less. And I think that's also a very great transition to our next guest speaker, who's going to speak about more invasive treatments like lasers. And I hope that after this talk, we will not be afraid of lasers or microneedles, because it can be painful, especially if you're using long needles. And maybe before I give word to Zach, one more last slide. We don't have enough maybe time to cover all the skin longevity dimensions, because skin longevity is really a very wide topic. It includes many different subtopics like nutrition, activity, sleep, mood, and so on and so forth. So that's why we put together with a sports scientist for Charité a skin longevity protocol, which you can find on our website, skin.de. It's totally free of charge. And you definitely find there much more hints, ideas, which we didn't cover unfortunately today, but definitely will be beneficial for your general knowledge. And it's also supported by the clinical studies, so everything get there. So thank you so much for the questions. Will you take the questions now or later?
Guys, now I want to gather. They have some questions now? Let's go.
There was this video where the ladies kind of put on the device. And it looked a bit random. Is there like a method to how you
Stamping method?
like how do you make sure you catch every area, or do you even?
Yeah.
Or do they choose which area they want to focus on? What is this?
Yeah, you generally want to cover the whole face area. Also, don't forget about neck and hands, just general recommendation as well. And generally, you want to do like 2-3 rounds. So when you stamp, you also cover kind of 50% of the previous stamp. And then you go 2-3 rounds to make sure that, you have enough microinflammation, temporary inflammation. That's the idea. So you will get red. That's okay. That's actually what you want to achieve. This redness, it fades very fast. Basically, in 24 hours, the redness fades, and you actually get that glow.
So with one of these like infusion things, that would be enough to like do the 3 rounds that you need to do.
Yes. So the formula,
and that's one session.
Yeah, the formula treatment is developed in the way that it's enough for the face, neck, hands, or decollete area. That's also possible. And it's recommended to do it every 2 weeks. So like the treatment is basically kind of 1 month, 1 month treatment. I have a box here. I can also show you later exactly how it looks. But yeah, every 2 weeks is enough time for the skin to recover. It a little bit depends also on your tolerance. You probably could do it also every week, but just to be on the safe side, because you never know who's more sensitive, who's less sensitive. It's better to do it every 2 weeks. Yeah. And maybe also one important thing to mention, to manage the expectations, right? Maybe coming back to your question, so what to expect. So again, here we need to understand the biology. So our skin renews every 4 to 6 weeks. This is the skin cycle. Yeah? So that's the time when you can see first result. And for collagen, it's even longer. So for the full cycle of collagen to produce, it takes between 4 to 6 months. So yes, you have to be patient, but again, if you want to stay young and beautiful, then probably that's not a sacrifice, but something. It's a common knowledge. You have to just be aware of that. I think so far we didn't have enough information, indication about that, and I think now more and more people are speaking about on social media through doctors' perspective and scientists.
And the ingredients of the fluids, are they different ones?
Yes, so
is it a mixture of things that are already in this?
Yeah, it's quite simple formula. So there are not too many ingredients because we also believe that it's not always good to oversaturate the formulation. So we focus on peptides. We have 3 peptide complexes, which works on different levels. The peptide is basically a signal mechanism, where it says what to do to your cells, and we work on the texture, on wrinkles, and also on the hydration. Or elasticity. Yep.
You said every 2 weeks for a specific time period? Or
Yeah, so the more consistent you are, the better results you get. Yeah, so it's not like a one-off thing that you did once, or you did 1 month, and then you stop. No, because unfortunately, aging doesn't stop. Right? So the idea is to preserve what you have already today. So if you start today, the idea is to preserve. Definitely, I'm not promising miracles. You not reverse, but you're definitely able to slow down the aging. Yeah. So if you want to reverse the aging, as we were speaking before, is probably you have to do a surgery. That's the only way how you can really achieve this drastic effect, right? But professional treatments or like less invasive treatments, they are more working on sustaining the natural youth.
Okay.
Yeah.
Pavel, thank you very much.
You switch.
Thank you very much. Super cool.
So I was already introduced. Isaac Arion is my name.
Okay, you hijacked the camera, right? Did you?
I think yes.
So who is the?
It's pointing towards my direction. So I'm a board certified dermatologist working here in Germany, and I have a private practice in Prenzlauer Berg. So I'm not just doing aesthetics or laser, I'm also doing general dermatology and skin cancer screenings. And like Olena already mentioned, small so-called minor surgery, so excisions, yeah, to remove suspicious moles or any other benign skin changes that cannot be removed with a laser. Yeah, and before I opened my own practice, I worked also at a longevity center. If anyone knows AIVA, it's in the east side of Berlin. There I worked as a dermatologist also, but I did all the trainings basically that other doctors did. So bio-age tests, microbiome analysis, the packages for longevity protocols, if anyone knows that. Has anyone done a laser procedure so far? What type of laser procedure?
I did it in Taiwan. I think Asia we have a lot of different type of lasers, and so I do not know the name in English, but it's quite a light one, and I hate it.
Hate it
So, I think our skin is very hot, very hot, the temperature sensitive. So anything that's warm, it's a torture. And I also don't think it makes a very big differences. Thanks to my skincare routine since I was very, very, very young. So for the cost and performance, I really think it makes sense to spend money.
Okay, and because of the pain, as I can hear.
10 plus, I don't think it makes big differences because I think I have good enough skin. So I wouldn't pay more to do more and do laser part for sure.
Okay. Would you still do the procedure if the pain would be like 0?
I think cost performance, like the money. I mean, it's very cheap in Taiwan because it's like all the doctor are working in those kind of skincare or dermatology because all the doctor will go take a Sunday or Saturday to do Botox, for example.
Okay. So weekends are like beauty treatments.
So it's like every five shop you have one. So it's very second most ranked top, like second in the world as a non-invasive treatment country. So people are just doing it very, very, very often. So for the cost, so then I will consider cost. I mean, I'm sorry, I'm so practical, but I think if you start early, young, and do all the right things, you shouldn't need this. I will try to not use those as long as possible.
Okay. We will talk about the pain part also in a moment. So I would like to talk today about lasers and IPL devices. So IPL devices are not lasers, but they're, let's say, similar devices that give energy in form of heat, basically. So here you see a bit of the difference. So lasers are more focused. They have a narrow wavelength. So for specific let's say targets, either pigment or redness in most cases. And the IPL devices have like a broader wavelength, and we can treat like more diffuse redness or diffuse pigment. So less specifics and more skin tightening effects are visible, but we have to do more sessions, what I already mentioned. Yeah, so it's less invasive, safer, but more sessions are necessary if you want to have the same effect as with a laser in general. So for the lasers, there are many kinds of lasers. So the majority of the people know maybe the ablative lasers where we actually vaporize the upper part of the skin. We can go, of course, even deeper, but then we'll have scarring. That's what we don't want normally. So has anyone done a laser procedure like this to remove some benign skin changes, warts?
Yeah, I did.
What removal was it?
I was believe something like worm that they said like we need to remove it. They just shoot it, but it was like basically evaporate. So evaporated like.
But was it like a benign thing?
Yeah.
Yeah. So how to know if it's benign? Someone trained, so normally a dermatologist should look at it with a magnifying lens first. And then we decide if it can be lasered or cut out. So if it's suspicious, it should be cut out. So that's an important difference. The other type of lasers, so what is normally well known for skin tightening, anti-aging, are lasers that work fractional, so that they make either like small channels in the skin. So the channels are also, the fractionated laser procedure is safer. That's why it's done. And from the areas around the channels, new collagen forms. Yeah, so you have like a skin tightening effect. Also, pigmentation issues can be treated with this one. But with this type, so when we have small channels, then we also see at the surface level edema, swelling, redness, and crusts appearing. Yeah, and this can take, depending on how much energy we use, from 1 to 2 weeks roughly after one session. So you have a downtime. Yeah. And newer lasers that don't make real channels in the skin, but they basically make heat columns. So it's less invasive. You don't have this much crusting. So maybe just a few flakes appearing the first few days and a bit of redness. Swelling is minimal. So that's why they are safer. But you'll have less effect. So maybe you'll have to do 1 or 2 sessions more to have a comparable effect to fractional ablative lasers. Any questions for this slide? Yeah.
How long does that last? I would think at some point it will wear off or something.
So depending what we are treatment here, so it's not just for skin tightening. So many times we also use it for scars. So if we use it for scars, we can do as many sessions as needed, but normally it's a price question also. So we do 3 sessions on average. But there is no upper limit. So as long as the skin recovers, so normally we wait 4 weeks until the next treatment. So there is no upper limit. You can do every 4 weeks a laser session, a fractionated.
Right, and your average client, like if I do the first 3, do you recommend that?
So if you're happy after 3 sessions, for instance, if we treated a scar, then it's fine. Yeah, if you're doing it for skin tightening, then maybe 3 sessions and then a repeat session after 1 year for
And then you keep
maintenance,
going on that 1 year.
if you want to keep the effect. Yeah, more questions? Okay, so why is this important? That lasers are more focused, so there are different targets, and the peak absorption of the energy of the laser is also different than depending on what type of laser we use. So some lasers are more focused on melanin, some on the red pigment in the blood cells, so hemoglobin, and some are focused on water. So the ablative laser for removal of benign skin changes would be focused on water, because the majority of the cells contain water basically to a large part, especially the skin cells and connective tissue. So IPL, intense pulse light treatments. So why does it work? So there is some data that it can lead to expression of genes that are normally seen in younger skin. So they tested this in a small study here. So they did biopsies before and after treatment, and after treatment with IPL devices, they saw that the gene expression of those cells is comparable to younger cells. One user is Brian Johnson also, so at least 2023 he used this treatment. I'm not aware if he's still using it, if anybody knows. Yeah, so he has a protocol here. He's using a device from the US, I think, and he's doing full body treatments. So this is
So it's
not-
taking PDL on his face. Is that what that says?
Yeah, so BBL, that should be an American device. So it's not something that's common here, but some practices maybe have it, yeah. And he's doing full body treatment, so this is very time intensive and expensive.
And expensive.
Yeah. So we normally do face, maybe also neck, and then it becomes a price problem. Or not, depending what salary you have.
Or your priorities are.
Yeah. So as I mentioned, so IPL, those are the two devices that I use. So Nordlis is from an American company, Candela. And there are basically two handpieces that I use. So handpieces, you can imagine it's like basically a joystick that you change. And then you can treat specific problems. So the PR would be used in lighter skin types for instance, for that redness. But also to a certain amount, it treats pigmented lesions, so sunspots mostly. Has anyone done a treatment like this so far? No.
Would it be for me? You said that I have some problems.
So Brian Johnson is doing it, and he doesn't have any, so no visible pigment spots, no redness, and I think he's still doing it. So as a maintenance therapy, I think it could work. So there is some data, not just a small Stanford study. And the data that is coming now is promising. So for like skin longevity maintenance.
What is the cost on this like lower than say going and getting like, you know, a fractional laser done or something along those lines?
Yeah, so fractional laser, as I already mentioned, you have more downtime and a much higher effect, so more tightening.
It's not that. So I have a little bit of pigmentation is kicking in, and also you see I had some like, red little dots, right?
Yeah.
So what would be the best price and effectiveness for me if I optimize for redness and pigmentation?
So if you want to treat both effectively, pigmentation and redness, then I would suggest IPL. Because the fractional laser can, in certain cases and darker skin type, also lead to more pigmentation. So,
IPL.
yeah. So not every laser is for every skin type, every ethnicity. So we have to adjust it according to the patient, yeah? Yeah, so the other VL handpiece can be used for pigmentation issues. It also covers a bit of the red spectrum, so also blood vessels, but to a lesser degree.
Are these results after your 3 initial sections?
So the one on the left, I think it was after 3 sessions, yeah.
That's crazy.
Yeah, that's good.
I mean,
So
I
no-
look like a baby. How much does it cost?
Very great.
So on average, depending if you do full face, then you have to expect around 450 euros. Yeah.
One session.
Yeah.
Ooh.
Some just want to have the cheeks treated or nose. Yeah, rosacea patients have normally redness on the nose and cheeks.
It looks incredible. And the right woman, she has rosacea?
Yeah, so that would be called rosacea, an inflammatory skin condition that's visible with basically where you see redness and facial blood vessels on the cheeks normally, nose, sometimes even on the chin. And it can be treated effectively with IPL devices.
That's pretty impressive.
Yeah. So we can enhance all those effects of lasers with the right skincare also and sun protection. That's what I always recommend after every either laser or IPL procedure to at least wear sunscreen 4 weeks after that as a precautionary measure to not develop any sunspots or pigment spots. So the stronger lasers are the ablative lasers that we normally use for removal of certain skin changes. So we always first look with the magnifying lens if it's something suspicious, could be cancer or not. If it's cancerous, then or there's a suspicion it could be, then it's normally cut out. If it's benign, then it can be removed with an ablative lasers. So the majority use either a CO2 laser or erbium. In my clinic, I have an erbium laser, and it's also effective. It has a certain upsides and downsides if you compare it to CO2, but it's safer also for darker skin types. Any question here?
For skin cancer, why you can't use laser?
Because if we use the laser, we're not sure if we removed every skin cancer cell. If we cut it out, then we can be pretty sure because it's sent to the lab and tested by histopathologists if there are any rests of the skin cells on the margins of the skin that was removed. Yeah, and with lasers, we cannot be sure if anything is left. And in this case, it could spread then. Okay, so the same laser device can also be used in a fractional mode. That's done so that we just change the handpiece, so as if you would change a joystick basically. And then it makes like small holes, as I already mentioned. So the fractional ablated one makes those columns basically, and from the borders of those columns, new collagen is formed, so we have more skin tightening effects. Also very good for scars, fine pores, and in general skin texture. Sorry?
The effect is the same.
Yeah,
Face
so-
1 month.
So this one, it's not that good here on this picture, but depending on the energy we use. So we have, if we use more energy, then we of course have more redness, more stress, more edema, sometimes even liquid is coming out like the superficial wound basically. Yeah. If we use less energy, we'll have less downtime. The redness maybe only for a few days, less crusting, but then also less effect. So it can be adjusted. Yeah. So maybe 1 week before a marriage or something, I wouldn't do the stronger. I wouldn't do the higher energy, but the lower one. Yeah. So at the newer devices work non-ablative, so they don't make like small channels, but they can heat the area, so like heat columns, and this also leads to skin tightening. But mostly we use it for like moderate or light wrinkles, not the deeper ones. Yeah, so for the deeper ones, I would go with the fractional laser, and for acne scars also. So this one is also safer because it's only basically heating the skin in the deeper layers. So we have two handpieces here, one that's specific for deeper layers and the other one for superficial layers. So for the superficial layers, so like really light wrinkles, skin texture, pores, yeah. And the deeper one can be combined with the superficial one, so we have more effect, yeah. So normally we do 2 or 3 passes, so in every direction. Any questions here? So this would be, the deeper laser would be painful. That's why we normally apply anesthetic cream, like 1 hour or 30 minutes before the treatment. With the superficial one, if we do only the superficial one, it's not necessary. And this type of laser, what do you think? Would it be painful?
Yes.
Yeah, so this one always needs an anesthetic cream. Yeah, and there are also lasers that are specific for vascular changes, so blood vessels, angiomas, rosacea. So specifically, it targets the lasers on the cheeks and the nose very well. So my laser is a KTP laser, a Quattro-Star. Anyone done a procedure like this so far?
How much does it cost?
So depending on how many blood vessels I see, if there are lots of them, then maybe cheeks, nose, around 350
How many
per session.
sessions?
So if you have blood vessels around the nose, I would suggest expect 2, because they are a bit stubborn. Okay, so what Pavel already mentioned, so with tiny needles, channels can be introduced in the skin, but this can also be done with a laser. And here we can also infuse certain medications or serums, antioxidants in the deeper layers of the skin. So this can be done with a fractional laser, but also with the non-ablative fractional lasers is the company that's behind those lasers that I have, they had done some testing, and they also saw that serums, for instance, penetrate deeper if they are used directly after the treatment. I have like free videos. If we then we can show it.
Yeah, open.
So I will maybe deactivate the sound. So those are the hand pieces. So you can just change the hand pieces and adjust it accordingly if you want to treat the pigment more or the redness. So that's a similar picture that we already saw. Pigmentation, redness. So that's the IPL and laser device. So if those hand pieces are both two IPL hand pieces and two laser hand pieces. So first we usually clean the skin. So skin disinfectant. So before the disinfection, of course, the patient already had anesthetic cream on the face. 30 minutes or at least 30, sometimes even 60 minutes are necessary. And this is the handpiece that the lady has in her right hand. So this one is for the IPL treatment. And if we mention again the pain, so this procedure now, if we shoot like this, it feels like a sting or like a light burning sensation. So it's still under the anesthetic cream. It feels like this. So if you treat like sensitive areas like the neck, you have to be patient. So it's not without pain. So for the whole face, if we're very quick, it takes up to 20 minutes. So the gel that is applied here, that's ultrasound gel. So the IPL doesn't work without. So that would be Olena's next treatment. So eye protection is necessary here because of the light here. So it's visible light that's filtered basically. So the same device has the laser handpieces, so they are just exchanged basically, and then we can do also in one session the laser procedure. So we can combine this. Combined treatments are optional. So some patients want more effect, more skin tightening, or more to treat more the redness or pigment issues, and both treatments can be combined. So we often combine the PR handpiece and the fractional laser, the deeper one, sometimes even the superficial one.
So you can just like really you can get all three basically.
Yeah. So excuse me, not the fraction, the non-fractional handpieces that are here. Yeah, it can be combined, and the company behind it also has some data that you have more effects, and it's safe as long as we keep the energy at a certain level depending on your skin type, the skin color. Yeah, so it can be used for almost all skin types up to Fitzpatrick 4. So that would be like Mediterranean, Latino skin. Yeah, darker skin types, there are something like Pavel's microinfusions or microneedling would be safer due to pigmentation issues. So you see already visible redness. So the skin after this procedure is red maybe for the day of the procedure and the day after. If we combine it with, it's at the end. If we combine it with the lasers, then you also have, if it's the superficial non-fractional laser, then you also have a bit of crusting the days after the procedure, but this can be countered with a moisturizing cream. Any questions?
What depends the price of laser treatments?
So if I see a patient with like only 2 blood vessels, then the price is of course smaller because it takes less time. If there are like blood vessels all over, then I'll need more time or more sessions.
So it's about expertise time.
What's the difference between plasma pen and laser?
So plasma pen is a different kind of technology. So heated plasma, so I'm not working with those devices, but what I've heard about it, it's not that safe. So it can also cause scarring. Some people are using it on the upper eyelids and they have dots, like visible dots for many months. So I'm not that convinced that it's safer. Any other questions?
So the effect is similar to the microinfusion,
Which effect? Which kind of?
like
So you have more collagen production, so stronger effect if we use the fractional laser. Yeah, the fractional ablative laser.
fraction and for
Yeah.
my redness and
So I saw your skin already. I would suggest still IPL.
so okay, so the problem
You don't have much scars, acne scars or anything, so I would suggest IPL is better.
What like IPL versus like RF microneedling?
So there are different kind of stimuli for the fibroblasts. So fibroblasts are the cells that produce collagen, and microneedling or radio frequency microneedling and lasers, they stimulate the fibroblasts in a different manner. So if you have the option to do both, then I would suggest do both in separate sessions, of course. So it's a money issue, yeah. But you'll have more effect.
okay. More questions, okay?
Low level laser, which is not invasive.
Do you mean photobiomodulation or something similar?
Like red light mask?
Kind of, but not exactly. So it doesn't create the channel, it goes deeper into the skin. But it's not heated.
Any specific device that
Yeah,
you
Lima. But it's for red. There's also protection.
So normally the at-home devices have lower energy, so you can expect less effect. Similar to the hair removal devices, Philips or what is used at the moment. So they have effects, but they are lower as any cosmetic studio products.
I tried it on Philips. It was so painful, listening to back.
Yeah.
It was like, yeah.
So pain management is still an issue. Still, there are some patients that are more sensitive, and I'm still thinking what to use. We reduce the pain, so we use a cooling device in between. So it reduces the pain, and then after the procedures, we use cooling pads, and patients can use them at home also. The day after the procedure, also 5 minutes, many times per day.
Okay, guys. Thank you very much for coming. Thank you a lot for our wonderful speakers. Pavel,
Thank you
Zach.
for having me.
Now I learned how much I need to money and honestly, I didn't ask how much the microinfusion costs.
99.
99 for how many
1 month?
sessions? 1 month, how many times? Once?
Consistently.
No, I mean, for 99 euros, how many
That's 2
sessions
treatments.
to treat?
Every 2 weeks.
Every 2 weeks. And then I would do like every maybe 6 months, or you would say
as often as you can buy. I mean, if you buy this for 3 months, it's also much more affordable.
Okay, thank you so much. Check our Luma calendar. We will have many other events on other topics related to longevity consultation. One more time, Pavel, Isa, John, thank you very much. And thank you for your great
Standing in front of the camera all the time, but
How do we end the stream this week? Bye, guys.